Okay, so now working with golf, what you want to know is if the person is a right-handed or left-handed. And what you're going to do then is, if a person is right-handed golfer, you're going to focus more when you flip them over to on the right chest and the left shoulder. And if a person is left-handed athlete, you're going to focus more then on the left chest and more of the right side for the opposite, so that you're going to kind of work opposite for them. Now, lower back injuries happen with golf, also wrist, forearms, and shoulders. So golf has a lot of arm work that we're going to be working with later too. Okay, so again, you can tuck them in. If they don't have underwear on, then you're just going to turn it back, or if their underwear are lower than normal, just kind of turn it back. You are going to warm them up again. Oil on. Now, also too different, just while we're at it, is there anywhere that I have to worry about? Are you okay?
Yeah, it's sore.
In here?
Right here.
Okay, well, we're going to have to work that area a little bit, but we'll back off from pressure. Okay, so. Now, she's a little warm up here compared to down here, so I have to try to, just do some Swedish massage moves to help change the energy and help change the heat and the cold, warming her up. Again, even while I'm doing warm-ups, I'm using this table with my legs so that I don't have to put so much work on me and my back. Okay, is that okay if I do that?
Yep.
Now, depending on the client, she had said that she has a little bit of tenderness in her lower back, but we are going to be working her lower back, so I want to make sure what pressure is okay, so just ask your client. Okay, we're going to be working a lot into this area, so this is now where I'm going to focus to try to warm her up. Is that still okay?
Yep.
So the first one that we're going to get really into is deep elbow glide from the sacral border to the lower ribs. So from here, getting into here. So I'm going to come down. Now go a little bit careful into the kidney area, but I'm going to try to get right into here. So her spine is here. I'm going to work these muscles in here. Okay. So working then into an elbow. So here we go. I'm going to go lightly first, just so that she can kind of get used to it. Back off when you hit the ribs. And if you have to, just breathe. Okay, and you're going to do that about 3 times. And then we're going to take the thoracic spine here, but it's the muscles right along in here that we're going to be working. And we're going to deep glide along that area. Okay, so stay right off the rib cage. Now it says to do it about 6 times. So what you can do is go a little bit lighter and then go a little bit deeper. So I'm changing my body position just to get in there a little bit deeper. Is that pressure okay?
Mm-hmm.
So once you've done that, whatever times that you're thinking, then you're going to rake the ribs with your fingertips You could change sides of the table to do it also too. Just move around the table and do it the other way. And your fingers are just going to go in between the bones. Now we're going to get into deep hand glide, stripping along the spinal border here with the scapula. So it's this area here that I want to start working it with now. Okay, so you might be able to see your fingertips, and that's good. It's just when it goes red to, you know, it comes up red and then instantly disappears, it actually means it's her blood is actually good. It comes to the top quickly, so that's actually a good sign. It disappears quickly too. Okay, and then from there, now depending on somebody, I might work this more depending how much issue they have in there. Right now she's pretty good. So now I'm just going to go into a forearm glide with the trapezius. Just using the meaty part of my arm. And I'm just gliding with my hand just to get into there, but the real pressure is with my forearm. And then we're going to get into with the deltoids in here now with the thumb. So now you're going to work into get into the muscle here. So I might do fanning, stroking one at a time just to move into that deltoid just to help loosen it up. And then you would do the other side. So just to see the deltoids a bit better again, you're just going to work into here. So with your thumb stroking or fanning, you can use one hand and get in there with the thumb a bit and just move along in that muscle, relaxing, get a little bit up in the trapezius. You need to just to back off for a sec and get back in. Okay, and finish it. Okay, so now we're going to work into the hip area, and she is warm in here anyways. She's now with her body, she says she's a little tender up in here, but we're going to be working this part of the hip area in here. So depending which side that you want to start on, I use the table again, warm up the area through the sheet, and we're concentrating on the outside hip muscles and kind of just above the hip bone in here. Is that pressure okay?
Yep.
Okay. Now, she is warmed up in there, so then we're going to get into a bit of deep finger kneading. Okay, so I can kind of get in here, again, if you have to breathe. And so I'm just using my fingers just to kind of roll into that muscle. And right into the sacrum area in here too. And again, just get into the hip. And you're working it. So what it looks like is I'm working this part with my fingers. Okay. And then you would do the other side. Okay, so once you have them turned over and you're going to just adjust the sheet for them, we're going to put some oil back on. Okay, and so we're just gonna, warm it up a little and get in here a little. Again, I'm using my leg on this table to help support myself. Now what we're going to work on though is the chest area in here. And so I'm just going to warm this upper part up. You can feel the muscle into the chest area in here, the pectoris. Okay, and we're going to move it. Now I'm going to do chest compression. So my finger, I'm just going to have them up just a little bit so I'm not choking her or anything like that. And then I'm going to ask her to breathe. And I'm just going to press down. Let go. Okay. Breathe. Press down. Now, in here, I can also get into some chest compressions this way. Just get your heel of your hand into here, and I'm just going to open up her shoulders, but I have to kind of stand on my tippies, on my toes, so that I'm up higher. Okay, breathe. Okay, just to open it. And then I can also press downwards. So take a deep breath, breathe, and as she breathes down, I'm going to press more in that direction with the heel of my hand. So I'm going down more. So take another breath. There we go. Okay, so I'm going to do it again. Okay, and down. And we'll go out. Great. And then from there, we're going to do some stripping with the heel of my hand or with the fist. So just breathe, and I'm just going to bring that muscle just to the bone. I'm just going to strip a little bit here to the bone. You got to watch clavicle and the sternum, so stay weight. You're just working with this muscle in here. Again, if this was a man, you'd have a little bit more that you could work with. Okay. And do that a few times, and then you're going to work with the other side. So oil on for now the arms. Now she has a burn that's healing here, so I'll just be careful of that. Of course, any client that you have to work with what you have. So just form them up a little, but the work of this is really going to be in the elbows here. So we're just going to work in the elbow area. And my fingers underneath, I'm just kind of getting into the meaty part of the elbow there. And then we're going to just go in. I'm just going to protect her here, but I'm going to go into now working her forearm. So just warm it up. Okay, so just warm that area up. And then just, protect her. Now I have to be careful because of this area, but we're just going to work. That might actually be an issue. Okay, so we're just going to work this area. Now, she is a little tight in here, so I'm just going to massage in here a little bit more. Okay, and then what you're going to do is just go right into your hand massage. So you can do your typical ELD hand massage. Nothing wrong with doing those. They always feel good. But again, they're holding the golf club, and so their hand can be very tender in here too. So just do a little bit of a hand massage. So depending on how much time that you need and how much work it needs. Okay, just massage. Yeah. Okay, so now we're going to get into the neck area. And so she still has lots of oil here too, so I don't have to get into that. But I'm going to then get into her sides. I can do both at the same time and just warm it up a little bit. Now, golfing, they would hold their neck too, right? And then they're looking and swinging. So depending to what side, one side might actually feel different than the other. Just gonna use my knuckles a little just to use in the trapezius, and then I can do just some drains, kind of like finger drains. And then if you wanted, you could do a little bit of circles. And then just slightly, with a little bit of pressure, go in. You'll see what pressure you can do with the client, depending on the client's neck and that. So you're going to do that area, and then you're also going to work again where you're back here and you're on that ridge here, and you're going to work this. And so I'm holding her, but I'm working both sides of the scalp area, and I'm just kind of walking my fingers down a little bit, kind of gliding my fingers down. So I'm just going to turn so that they can kind of see. So it's just kind of like a shimmying down just in here. Okay, and that's all that you have to do, and that would be that massage.